Hello guys, I am Dr. HRITHIK, emergency and general physician. Okay, today we will discuss about clinical decision making. Okay, in objective we have discussed introduction, definition of clinical decision making, some causes of diagnostic mistake and physical examination. Okay, first we have to move on to the introduction. Okay, introduction means the basic information about physician. Physician should be highly skilled, basic knowledge and good communication relation to the patient and doctors. They should have some basic information. Physician means highly qualified, removing the disease from sickness. Okay, and introduction is over. Then definition of the clinical decision making. In clinical definition means it is knowledge, skills and behavior of the patient. Knowledge, skills and behavior of the patient. You know the basic information about skills, good communication, knowledge about the medical and patient, knowledge of the relation to the patient and doctors, and behavior, good behavior like a friendship. Doctor and patient should be like a friendship. Okay, then next move on to the some causes of the diagnostic mistake happening in the during the diagnosis system. It is three causes. First one is lack of knowledge gap. Second one is misinterpretation of the diagnosis test, means simply sending the investigations. And third one is cognitive biases. First one is knowledge gap. Knowledge gap means it is some lack of knowledge about patient, about disease, about symptoms. Physician should be know about perfect knowledge about the disease and care of the patient. Okay, second one is misinterpretation of the diagnosis test, means some patient having pain in the rightly iliac abdomen, and simply sending USG abdomen scanning, it is having some colic and kidney stones. It is not relation to the liver. Okay, it's not relation to the body part. And misinterpretation means some without checking of the patient, without examination of the patient, simply sending the investigations. This is happening. Okay, and third one is cognitive biases. Cognitive biases means it is a condition of which without taking history of the patient, directly sending to the investigation. It is not good for the patient. First you have to ask the investigation, history about the patient, signs and symptoms, then move on to the investigation. Okay, and some root causes of the diagnostic mistake. Some root causes of the diagnostic mistake. It is means three types. No fault means a lack of information about the patient and disease, lack of information, lack of education about the disease, human anatomy. Okay. Second one is systemic mistake. Systemic mistake means which poor communication in the all the staff nurse, staff workers in the hospitals, lack of knowledge about the information and treatment of the patient, lack of knowledge, lack of good communications. This is happening. And third one is human cognitive biases. Human cognitive mistakes means like a physician, they do not have perfect memory power, lack of knowledge, and not perfect specific diagnosis making, and they are making only probable diagnosis, not complete symptoms taking, complete signs and symptoms taking. Negligence should be there in the human cognitive level. Okay, and next move on to the physical examination. Physical examination, you have to very important for the patient complaints of chief complaint and previous history of the disease. We have to ask the signs and symptoms, duration, location, sensation. Okay, clearly you have to ask the patient before coming. Asking patient, tell me about history of your lifestyle. They should tell. Okay, without knowing history, not directly go to the diagnosis and investigation. But you have to ask the history of the patient. Like patient is example, patient is coming, I have fever and headache since 2 days. After written symptoms, directly not go to the, it is a meningitis. First you have to correct the headache, fever and stiffness of neck. You have to check and ask the duration of the duration of the suffering disease, and not directly go to the, it is like a meningitis. You have to take lumbar puncture test. You have to make CT and MRI scan. It should be not there. First you have to treat basic information, basic symptoms. Then after it is not curing, then we have to move on to the another investigations like lumbar puncture and CT MRI. Okay, it is a discipline and maintenance should be there in the physician habits. First you have to take signs and symptoms, ask the duration, give some medicines, basic medicines, check 1 to 2 days. After coming patient, it is not cured, then move on to the second investigations, diagnosis and higher remedies, higher drugs. Okay, directly should not there directly sent to the investigation, USG, CT, MRI should be not there. Okay, my conclusion is, some patient about physician and nursing staff, hospital workers should have some basic physical fitness, good memory power and good diet should be there. This is my conclusion. Physician should have healthy fitness and taking healthy diet, and the nursing staff and other hospital workers should have, they will be present taking physical fitness and healthy diet and some good memory power. There is some fitness is good due to curing of the patient and caring of the patient. Okay, thank you, love you all. We move to the next video. Okay, bye bye.